Bipolar disorder, fight the stigma. Hello everyone, welcome to our channel. If you're returning, it's great to have you back. And if you're new here, thanks for joining us. Today, we're delving into a topic that touches the lives of millions around the world, bipolar disorder. This condition, often shrouded in misconception and stigma, profoundly impacts those who live with it, both directly and indirectly. Bipolar disorder is a mental health condition previously known as manic depression. It's characterized by significant mood swings that include emotional highs and lows. These aren't just ordinary mood changes. They can be intense, persistent, and disrupt daily life. In this video, we aim to unravel the layers of bipolar disorder. We'll discuss what it really is, the signs and symptoms to watch for, the different types it can take, and how those living with it can manage and find balance through effective treatments. Our goal today is not just to inform, but also to reduce the stigma associated with this disorder. By understanding more about bipolar disorder, we can foster empathy and support for those affected. So, stay with us as we explore this important topic, and hopefully, by the end of this video, you'll have a better understanding and can perhaps help someone in your life. Let's dive right in and start by defining what bipolar disorder really means and why it's so much more than just mood swings. What is bipolar disorder? So, what exactly is bipolar disorder? It's a mental health condition that causes significant emotional swings in mood, energy, and activity levels. These aren't just the normal ups and downs that everyone experiences. They are more extreme and can affect your ability to function in your daily life. The term bipolar signifies the two poles or extremes of mood that people with this condition oscillate between. On one end, there are the manic phases, where individuals may feel overly joyful or up, often with a hyperinflated ego. And on the other end, there are the depressive phases, where they might experience profound sadness or hopelessness. During a manic episode, someone might feel unusually energetic, irritable, or excited. This can translate into talking very fast, having racing thoughts, or engaging in risky behaviors. It's a high that exceeds normal happiness, and while it may feel good at first, it can quickly become unsettling and dangerous. Conversely, the depressive episodes bring about an entirely different set of challenges. During these times, the same person can feel extremely sad, indifferent, or even hopeless. They may lose interest in activities once enjoyed, experience changes in appetite or sleep patterns, and in severe cases, have thoughts of self-harm. It's crucial to understand that these mood swings are not something that those with bipolar disorder can simply snap out of. They are severe shifts that can profoundly impact their thoughts, behavior, and life. Now, you might wonder, how common is bipolar disorder? Well, it affects about 1% to 2.8% of the global population, with symptoms usually first appearing in late adolescence or early adulthood. Despite its challenges, with the right treatment and support, many people with bipolar disorder lead fulfilling and productive lives. Now that we have a better grasp of what bipolar disorder encompasses, let's move on to the symptoms to look for if you suspect you or someone you know might be dealing with this condition. Symptoms of bipolar disorder. Identifying the symptoms of bipolar disorder is key to understanding and managing this condition. Let's take a closer look at what these symptoms typically involve, starting with the manic episodes. During a manic episode, individuals might experience an abnormal increase in energy and activity levels. They might feel elated, almost euphoric, or irritable, and on edge. It's not just feeling energetic. It's an intense, often uncontrollable surge that can lead to impulsive decisions and risky behaviors. Imagine feeling so upbeat that you decide to go on a shopping spree you can't afford, or start a dozen new projects at once without thinking about how you'll finish them. You might talk faster than usual, your thoughts might race, and you might find it hard to focus on any single task. Now, transitioning to the depressive episodes, which can be equally challenging but in different ways. During these periods, individuals might feel a deep, unshakable sadness, lose interest in almost all activities, or withdraw from life altogether. The change can be drastic. Someone who was lively and energetic a week ago might suddenly find it hard to get out of bed. They might struggle with sleep, either sleeping too much or not at all, and might face significant changes in appetite. Moreover, cognitive symptoms are also prevalent, such as difficulties in concentrating, making decisions, or remembering details. These are often accompanied by feelings of worthlessness or excessive guilt, and in severe cases, these depressive episodes can lead to negative thoughts. It's important to recognize that these symptoms aren't just bad days. They are intense and persist over time, significantly impairing the individual's ability to function. That's why understanding these signs is crucial for early intervention and effective management. With these insights into the highs and lows of bipolar disorder, let's move on to discuss the different types that this disorder can manifest as, which can help tailor the approach to treatment. Types of bipolar disorder. Bipolar disorder manifests in several forms, each with its own pattern of symptoms. Understanding the different types of bipolar disorder is crucial for diagnosis and treatment. Let's explore these types. First, we have bipolar I disorder. This type is perhaps what most people think of when they hear bipolar disorder. It's characterized by manic episodes that last at least 7 days, or by manic symptoms so severe that immediate hospital care is needed. These manic episodes are typically followed by depressive episodes, usually lasting at least 2 weeks. Next is bipolar II disorder, which is less severe in terms of the manic phases but no less challenging to manage. People with bipolar II experience what's called hypomania, a milder form of mania. These hypomanic episodes can still impact daily life significantly, but don't typically require hospitalization. However, the depressive episodes can be just as severe as those seen in bipolar I disorder. Then there's cyclothymic disorder, or cyclothymia. This type is a milder form of bipolar disorder. Individuals with cyclothymia experience periods of hypomanic symptoms and mild depressive symptoms for at least 2 years, but these symptoms do not meet the full diagnostic criteria for hypomanic or depressive episodes. It's important to note that these types are not just categories, but reflect a spectrum of experiences. Each person's experience with bipolar disorder can vary greatly. Some may have clear and defined episodes of mania and depression, while others experience a more mixed state where symptoms of both mania and depression occur simultaneously. And diagnosing the type of bipolar disorder can often be complicated because symptoms can overlap with other mental health issues, such as depression or anxiety. This is why a thorough evaluation by a mental health professional is crucial. Recognizing the type of bipolar disorder someone is dealing with is essential, as it guides the treatment plan. Treatment might include medication, psychotherapy, lifestyle changes, or a combination of these. But before we discuss treatment, let's make sure we understand the causes and risk factors associated with bipolar disorder. Causes and diagnosis of bipolar disorder. Understanding the causes and how bipolar disorder is diagnosed is crucial for getting the right help. So let's explore what leads to this condition and how professionals determine if someone has it. Causes of bipolar disorder. The exact causes of bipolar disorder are complex and involve a combination of factors. Let's break these down. Genetics play a significant role. If you have a family member with bipolar disorder, your chances of developing it are higher. Research shows that bipolar disorder is more common in individuals who have a first-degree relative with the condition. Biological differences are also a factor. Studies have shown that people with bipolar disorder often have physical changes in their brains, although the link between these changes and the disorder isn't fully understood yet. Environmental factors are equally important. Stressful life events like a death in the family, financial difficulties, or relationship problems can trigger bipolar episodes. Additionally, substance abuse can exacerbate or trigger episodes of mania or depression. Diagnosis of bipolar disorder. Diagnosing bipolar disorder can be tricky and requires a thorough understanding from a mental health professional. Here's how the diagnosis process typically unfolds. It starts with a detailed medical history and a psychiatric assessment. Mental health professionals use the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, as a guide to diagnose bipolar disorder. During the assessment, doctors look for symptoms of mania and depression, their duration, and their impact on a person's life. It's important that these symptoms are not caused by other medical conditions or substance abuse. Sometimes, physical exams and lab tests are conducted to rule out other conditions that might be causing symptoms, like thyroid disease or neurological disorders. This process can be lengthy and requires open communication between the patient and the healthcare provider. Accurate diagnosis is crucial because it directly influences the treatment plan. Now that we understand more about what causes bipolar disorder and how it's diagnosed, let's move on to discuss the various treatment options available, which can help manage the condition and lead to a stable, productive life. Treatment options for bipolar disorder. Now that we understand the diagnosis of bipolar disorder, let's explore the treatment options. Effective management of bipolar disorder is crucial for maintaining stability and improving quality of life. Here's how it can be approached. Medication. Medication is often the cornerstone of treatment for bipolar disorder. There are several types of medications used to help control symptoms, including mood stabilizers like lithium are typically the first line of treatment to help manage the mood swings associated with bipolar disorder. Antipsychotic medications may also be prescribed if symptoms of mania or depression persist despite the use of mood stabilizers. Antidepressants can be used cautiously for managing depressive episodes, but they are often prescribed in conjunction with a mood stabilizer to prevent triggering a manic episode. It's important to note that medication needs vary from person to person, and what works for one individual may not work for another. Regular consultation with a healthcare provider is essential to find the most effective medication regimen. Psychotherapy. Psychotherapy, or talk therapy, is another fundamental aspect of treating bipolar disorder. It involves working with a therapist to understand the impact of the disorder and to develop coping strategies. Common types of psychotherapy include cognitive behavioral therapy, CBT, which helps individuals identify and change harmful thought patterns and behaviors. Family-focused therapy, which involves family members in the treatment process to improve communication and support systems. Psychoeducation, which teaches individuals and their families about the disorder, helping them to understand and manage it better. Interpersonal and social rhythm therapy, which aims to stabilize daily rhythms such as sleeping, eating, and activity schedules, helping to prevent mood swings. Lifestyle and home remedies. Managing bipolar disorder also involves lifestyle adjustments that support treatment, such as maintaining a routine for sleep, meals, and exercise can help stabilize mood. Monitoring mood changes and symptoms to catch and address potential episodes early. Avoiding alcohol and non-prescribed drugs, as they can interfere with medications and precipitate mood episodes. Joining a support group can also provide encouragement and advice from others facing similar challenges. Alternative treatments. Some people also find relief in complementary therapies, although these should never replace conventional treatments. These can include yoga and meditation, which help reduce stress and promote relaxation. Supplements, like omega-3 fatty acids, may have some benefits in mood stabilization, though it's important to consult with a healthcare provider before starting any supplements. Acupuncture and other traditional techniques, which some find helpful for managing symptoms and stress. Treatment for bipolar disorder is about finding the right combination of medications, therapy, and lifestyle changes that work for the individual. It's a personalized approach, and with ongoing care and adjustment, many people with bipolar disorder lead full and productive lives. Remember, the path to managing bipolar disorder can be a journey of trial and adjustment. Patience, open communication with your healthcare team, and support from loved ones are essential. Managing bipolar disorder and seeking help. As we wrap up today's discussion on bipolar disorder, it's important to remember that while this condition can be challenging, it is also manageable with the right treatment and support. Bipolar disorder doesn't have to define a person or limit their ability to lead a fulfilling life. Managing bipolar disorder. Effective management of bipolar disorder involves a combination of medication, therapy, lifestyle changes, and strong support networks. It's about creating a balanced life and knowing how to handle the highs and lows effectively. Education plays a critical role too. Understanding the condition empowers individuals and their families to make informed decisions about care and helps in recognizing the early signs of mood episodes. Suicide prevention and help. It's also crucial to address the risk of suicide, which can be a serious concern in bipolar disorder. If you or someone you know is struggling with thoughts of self-harm or suicide, know that help is available and recovery is possible. Never hesitate to reach out for immediate help if you or someone you care about is in crisis. You can call the 988 Suicide and Crisis Lifeline, available 24/7, where trained counselors are ready to talk and provide support. Alternatively, texting HELLO to 741741 connects you to a crisis counselor at the crisis text line. Remember, asking for help is a sign of strength, not weakness. Support from professionals, friends, and family is invaluable. Try to stay connected with your support system and share how you feel. Together, you can find ways to manage and overcome the challenges posed by bipolar disorder. Closing thoughts. Thank you for spending this time with me to learn more about bipolar disorder. If you found this video helpful, please like, subscribe, and share it with others. Spreading awareness is key to destigmatizing mental health issues and supporting those who are affected. And remember, you're not alone on this journey. There are many paths to support and recovery, and with the right tools and people by your side, you can navigate the complexities of bipolar disorder successfully. Take care, stay informed, and I'll see you in the next video. Remember, every step towards understanding is a step towards healing.